Audrina is our miracle. She's loving, kind, sweet, and happy.
I'm gonna do Twinkle Twinkle Little Star.
She has been through a lot, but you would never know it. When she was born, everything looked great.
It was the happiest day of our life. First day, everything was fine, just typical, doing the pictures, posting on Facebook and all that.
And then the next day, they noticed a murmur.
Then we were told, instead of going home, we're going to be relocated to a hospital, that our daughter had a congenital heart disease.
They came in and told us that she had truncus arteriosus. They told us we'd be going to Johns Hopkins, all children's.
Are we ready? Truncus arteriosus is a disorder where normally we have two arterial trunks that come off of the heart. Instead of rotating and splitting into the two vessels, the vessels never separate and become one common arterial trunk.
Once we got to the hospital, we went up to the neonatal intensive care unit.
And they brought us into a bigger NICU room where Audrina was. And we remember just seeing her. She was already attached to tubes and wires. And they came in and they comforted us and they said, we're gonna get your baby better.
On day 8, she had open heart surgery.
Dr. Jacobs and his surgical team did an open heart procedure where they repaired Audrina's heart.
Let me go get you some juice.
Audrina will be 7 years old in October, and she's had 2 open heart surgeries, one when she was 8 days old, one when she was 4. It's a very extensive surgery and the healing is very difficult.
Unfortunately, the conduits that we put in babies are the perfect size for them when they're a newborn, but babies grow very rapidly, so they often outgrow the conduits sometime in the first 3 to 5 years of life.
We play a hole.
And you can see the color flow going through here, and it looks very speckled or turbulent.
We noticed once again the conduit that we placed when she was 4 was starting to narrow.
The options for her were to send her for another open heart surgery, or we felt that if we could safely expand this conduit up to a bigger size that would accommodate a valve that we could put in with a catheter. The Melody valve is a valve that's mounted inside of this stent, which gives it its support structure. We're able to mount them onto a balloon and deliver them to the intended area and inflate the balloon to expand the valve to its intended diameter.
They didn't have to do any type of cutting other than a small little incision in her leg to go up the femoral artery.
She was back to normal activities within a week after having it.
Research is very important for what we do in congenital heart disease because we are learning how to do much more innovative procedures that allow these patients to live longer and live more productive lives.
When I grow up, I want to be a doctor at Audrina.
They do such a great job at Johns Hopkins All Children, so even when she goes in, she's never scared.
That's the unique thing about our field in pediatrics. We're one of the specialties that is trained and licensed to take care of our patients throughout life.
I'm happy to see Dr. Stapleton and Andrea. And when she's done, she gets bubbles.
Seeing patients like Audrina now doing so well and being able to participate in all activities is what makes this the most rewarding.
Audrina is my hero.
She's strong and she just has such a will. And
I don't think you could do anything to slow her down even if we needed to.
Hot chocolate! We're supposed to scream hot chocolate at the end.